Qualified, professional, and compassionate doctors talking real solutions to real health problems.
Tonight on the DocTalk show, we're discussing weight, in particular overweight and obesity. Did you know that being overweight and being obese puts you at high risk of high blood pressure, of diabetes, stroke, and heart disease? All this can be averted if you watch what you eat and if you keep your weight in check. Tonight with me in the studio is a nutritionalist and a wellness expert, Dr. Kasenene Paul, who is going to discuss with me how exactly we can lose weight and how we can keep our weight in check in order to prevent these non-communicable diseases. So welcome with me our guest to the studio, Dr. Paul Kasenene. You're most welcome.
Thank you, Dr. Darius.
And I am your host for the evening, Dr. Darius Owachi, and we thank you all for watching the DocTalk show. So let's get started, Dr. Paul. Weight now is becoming a big problem. Worldwide obesity and being overweight have been linked to conditions such as high blood pressure, high sugars, strokes, and heart disease. Actually, in fact, 25% of Ugandans are found to be overweight and 10% are obese. So help us understand what these concepts mean. What does it mean when you say someone is overweight and someone is obese?
Thank you, Dr. Darius. So this concept of weight is really about how heavy we are. And being normal weight means that you have a certain amount of flesh and weight that is sufficient for your frame, for your skeletal frame. And some people start to have more weight than their body can actually comfortably accommodate. And we generally have a scale, something we call the body mass index. And that looks at what is the ratio of your weight to your height.
The weight to the height, what they abbreviate as BMI.
Yes. And so generally, depending on your height, there's a certain weight that is comfortable for the body. And the normal body mass index range is between 18 to 25. So the body mass index is a calculation that looks at your height and your weight. Now, anybody who is above 25 is actually considered overweight, and that goes between 25 to 30. Now, if you're above 30, then you're obese. So you get your weight in kilograms, you divide that by your height in meters. The answer you get, you divide that by your height in meters again. But maybe sometimes these terms can make people get a bit confused and can make it a little bit complicated to understand. But really what we're trying to say is that do you have enough weight for your skeletal frame? And BMI just helps you to figure out whether you need to lose weight or not. Like you said, about a third of Ugandans are overweight. In corporate Uganda, it's about 68% of people who are overweight. And so what we really want people to understand is, can you assess yourself and see whether you have normal weight or you're overweight? And BMI is just one of the tools that helps us to do that.
Okay. So apart from the BMI, I know it's one of the most common ways to determine if one has good weight or not. Are there any other methods that are available to determine if one's weight is appropriate, apart from the BMI?
Yes, so there's three things that are very important. Your BMI, one. Secondly, related to your weight is your waist circumference. So sometimes people have a normal weight, but their waist circumference is a little bit bigger or smaller than it should be. So on average, for a man, anything above 37.5 inches is considered high. And for a lady, anything above 32.5 inches is considered high. So we need to look at that as well. But the most important thing to look at is actually how much fat and muscle you have within your weight.
Okay. How much fat and how much muscle? Can they be measured? separately.
Yes, so you can measure them using biometric scales, where you can say that based on your age and your height, you should be have a certain amount of body fat. Generally, for men, you should be 20% body fat and 40% muscle. And for ladies, usually it's 30-30, 30% fat, 30% muscle. Now, we do see some people who have normal BMIs, okay, normal weight, but they have higher body fat than they should. And we do see people who are more muscular, who have slightly higher BMIs, but have a normal body fat percentage. So you want to look at all these three things together: waist circumference, body mass index, body fat, and muscle percentages.
Okay.
And together you can get a picture.
So which is better, to have more body muscle or to have more body fat?
So there's generally
Because
there's
I think BMI won't differentiate the two, whether it is your weight is due to too much fat or your weight is due to too much muscle. So which one is to worry most about?
So generally, if you have more fat, then we're really getting into dangerous areas. But what is important is that people should understand that you can be technically overweight because you have a higher body fat percentage than you should, than is acceptable for your age range. And this is why when people go to check on a weighing scale, what you see as a number is just a rough indication, because your BMI is just a general indication of your weight status. But what people want to be checking is your body fat and body muscle percentage. And these can be checked, and it's not very complicated. And they actually shed more light, because some people are surprised to find that they actually have much more fat than they should for their age. And so it's one of the things that can really be measured and checked.
Okay. So given that today's topic we're discussing overweight and how to lose weight, maybe we could go through some of the dangers being overweight poses.
Being overweight increases your risk for high blood pressure, for heart disease. It also increases...
In addition to diabetes and strokes too.
Yes.
Those are what they term the cardiovascular. Cardiovascular meaning diseases of the heart that would cause problems elsewhere.
Yeah, so generally we see a large number of people presenting with high blood pressure and heart-related issues, and these are always directly related to your weight. But we also have, very commonly that we're seeing more and more of, is people who are having issues to do with their musculoskeletal health. Joint pain in their knees, in their legs, back pain, lower back pain is directly related to your weight. Many people are struggling with arthritis, and you know, if you're even 10, 20 kilos above normal, then your knees are bearing all this weight, and so you can be at risk for that.
Okay.
But we also have many other medical conditions like hormonal imbalances that can come up as a result of having too much weight. This generally tends to manifest with ladies, especially where they get irregular periods or issues with their menstrual cycles. You can also have many types of cancers are now linked to our weight.
For example?
Yeah, we have breast cancer, we have ovarian cancer, we have prostate cancer. As long as someone is overweight, they generally are going to be at a slightly increased risk for many health challenges.
Problems.
Yeah.
And all these include the cardiovascular diseases and some cancers such as the ovarian, breast or prostate cancer. So you will appreciate that being overweight is a big problem, plus obesity. Comes with so many health challenges, and it can be quite an expensive disease to manage, I think. It's not, we're not, the epidemics of diseases in Uganda are changing from the infectious diseases where we see a lot of malaria and the typhoids and the likes, to more of the non-communicable diseases, when we're beginning to see more of hypertension, that's high blood pressure, diabetes, and strokes and the likes. And all these are linked to being overweight. So this is why we are discussing weight in this particular segment, and we want to tell you exactly how you should be eating and how you can lose weight. In the event that you're overweight, what foods should you eat in order to lose weight, or what can you do in order to lose weight, so that you can't be able to avoid these conditions that come with it. So again, remember you're watching the DocTalk show. Send in your questions on our social media platforms. That's Facebook, Twitter, and our doctors will ably respond to you. When you come back from the break, we shall discuss exactly what contributes to weight gain and how exactly one can lose weight.
You are watching the DocTalk show.